Good evening, everybody. My name is Cami. I'm so glad you're here, and I am particularly excited to tell you a story tonight. Um, I have this is very personal to me and also very fresh. In fact, I have pictures uploaded that we took about an hour ago into this slide presentation for you so you can see what has happened in 1 week's time. So here we go. Let me show you my slides. So excited. So we're talking this evening about using our phototherapy patches for your animals. And as soon as I figure out how to present in this format, we'll be doing great. So LifeWave says living well is not only for people. AccuLife is a patching system that was created for animals and is marketed for animals. And healthy living extends beyond humans. AccuLife embraces the same LifeWave innovations to support equine, or actually all animals, their vitality. And it's engaging the Eastern philosophy of acupressure and acupuncture points for your horse. So they're promoting a soothing effect, maintaining normal flexibility, and may help reduce discomfort. And then they're showing you how to patch. Okay. AccuLife, like IceWave, has a tan patch and a white patch, and you need to find the placement to put them. So, I, for me, I talk about when I'm placing IceWave on a human, I will talk about where the pain is, and I put the tan patch on the pain. And then if it's, let's say it's on somebody's back and their lower back hurts, I will put the tan patch on the lower left side of the pain. And then I will first start the white patch on the lower right side of the spine. And usually that knocks the pain out. But here you see it on horses. So acupressure is what they're talking about because in the LifeWave AccuLife patches, they will put a little round bead to place under the patch. But you and I know that the patches work without the bead. Acupressure is a valid way of serving someone, but we know that the patches also work without the bead on ourselves. So, anyways, that's just my little commentary. So, let's read the disclaimer together. LifeWave products are for general wellness and intended only to maintain and encourage a general state of health or a healthy activity. The content provided by LifeWave is presented in summary form, is general in nature, and is provided for informational purposes only. Always consult with your physician or other qualified healthcare provider before embarking on a new health regimen, diet, or fitness program. LifeWave reserves the right to change or discontinue anytime information relating to LifeWave's products. So I'm going to pause the horse. I need to find this video for you because it's amazing. And this is something that came up for me when I was first learning about the patches, and they were um, horses don't lie. It's pretty amazing, and they're showing how to patch horses with the LifeWave technology. So hang on just a second. Did you guys hear that video?
Yes.
Okay, cool. So when I get
When you
back to
get
sharing
that,
this.
Cami, let me just jump in. I don't mean to step on anything here, but I talked to a lady who's been in LifeWave for 14 years at a conference and who's very big in equestrian and the horses. The reason the Veterinarians Association, they wanted their own patch. And the reason for the bead was because the horse's hide is so thick. And by rubbing that bead, it pushes blood away and then it brings blood back to that area. So by rubbing that, it really kind of, and we can think that it wakes that area up. Does that make sense?
That's good news. All right. Well, I'm going to show you this video. It's pretty awesome.
Wearable technology, wafer-thin, lightweight patches that produce remarkable health benefits. If you're still working to wrap your mind around the more than 80 independent clinical and research studies that back up LifeWave claims, or if you just simply love this technology already and enjoy seeing it work fast, we've brought you to a quiet farm in Southern California to witness the instant power of LifeWave. Not on humans, but on horses. Because after all, horses can't be told how to react to this amazing technology. They just do, virtually every time. In fact, 2 published studies in 2005 and 2011 involving no fewer than 175 horses, one of them with a placebo-controlled element, showed significant reduction in pain using LifeWave, as shown by before and after infrared thermal images, plus generally accepted veterinarian methods for locating and measuring pain points in horses. I wanted to see for myself, and you'll get to watch right along with me. John Chance, a distributor in LifeWave since 2004, has been working within the equine industry with horse owners and rodeo competitors for years, patching thousands of horses along the way to help relieve their pain and discomfort. This Facebook video is a great example. John first locates the discomfort, then does his best to carefully place a patch near the pain. Not so easy. And just seconds later, the horse is calm and no longer reacting to pressure. Today, John has gathered several horses so we can see for ourselves what happens as he applies patches, with their owners looking on. Didn't take him too long to find some pain.
That's pain.
On goes the patch. And then look at the difference.
Stand right here.
Oh, wow.
And just push as hard as I can.
Here's another one.
Okay, that's pain.
Patch goes on.
No reaction. Pain is gone.
And now watch this.
About went to his knees. When I done this a minute ago, what the horse done? The horse kind of stumbled.
But once again, with LifeWave to the rescue.
You see horse?
I see.
No reaction.
No reaction, okay. Now what John did next really does bring focus to how fast this technology can work.
I removed the patch.
Oh.
I'm going to take them off. Pain's probably already back. Watch.
No kidding. He's reacting.
Reacting. Again.
Just like that.
Yep. And we're going to repatch again.
And it won't react?
Won't react.
On go the patches again.
Wow.
I heard a wow over there.
Yeah. Till you see it in person, they don't believe it. All right?
And with the patches back on? Look at that. Oh, that's incredible.
And again. See, I'm just digging in that spot.
Yes, you are.
I'm digging, more pressure. And this is danger zone. I'm asking this horse and inviting this horse to kick me.
He's calm down. He's calm down.
Unbelievable. So basically, the whole point of this, doing this in the first place, John, is that horses, they don't know anything other than to be a horse and to react to what's going on. They don't know placebo. They have no agenda. And that's the whole point of this, is to say that this technology works that fast, whether it's a horse or whether it's a human. So you know what you need to do next. You need to get patched. AccuLife for horses, X39 for humans. Contact.
Isn't that great?
Great. Yeah. Wow.
Pretty cool, huh? So
Pretty interesting.
that I wanted to share that with you. And now I want to give you a little bit more information. So this we're going to be sharing some personal stories here. As soon as I find my PowerPoint, I lost it. Hang on. Yeah, sharing some personal stories about the patches here because um, sorry, technology has, okay. So the Veterinarian Association is now starting to recognize phototherapy as for animals as a viable treatment for animals. And you can see here, backed by research from reputable veterinarian journals, phototherapy or red light therapy is shedding new light on new ways to alleviate pain, accelerate healing, and overall improve health of dogs here. So, what about the rest of these patches? And this is how my brain thinks. If our bodies emit a low level infrared light and animals emit a low level infrared light, what do we have to lose about trying the other patches as well? So just so you know, IceWave and AccuLife are the patch themselves is exactly the same patch. So if you happen to be around a horse in pain, you could use the IceWave patches on the horse, and the horse would receive the same benefit. So just so you know that. But what about the other patches? So we're going to show you, we show this picture often in our regular slide presentation. We recommend that you take your used patches off of you and then put them on your animals. How do you put them on your animals? Sometimes they stick directly to the fur. Sometimes if they wear a collar or a little jacket or something, then you can stick it to the inside of the jacket. So we have all different ways we can do that. And I'm going to tell you a story about a horse named Chance. So Chance was um, uh, learned about the LifeWave patches from her veterinarian, and he started using these patches. He started using X39 to support natural tissue repair, healing, and activation of his repair cells, and Eon to reduce inflammation, and carnosine for his antioxidant protection and muscle tissue recovery, and X49 again for, a lot of horses are athletes, and that gives them an extra dose of those repair cells for their athletic recovery. So he, um, he, it, the horse owner loves these patches because there's something that they can do. They don't have to call a vet out all the time to tend to the horse. This is a great way for the horse to recover from their exercise or the injuries that they do as they're working or competing. And it's non-invasive. It's not something that you have to do surgery or blood draw, not invading. There's no needles involved. There's no dosing required because you're not adding anything to the body but light. So, Joyce, would you like to unmute and super briefly tell us Lucy's story
Wow.
in about 2 minutes, my girlfriend?
Okay, I'll keep it short. Do you
Mm.
have the photos I sent you, Cami? Good.
Yes, I do.
Okay. Well, before this happened, when I got her, she's around 11 now, but when I got her at 2.5 years old, they didn't know because I adopted her. She came right out of a puppy mill, and she's 3/4 boxer and a quarter bulldog. So little bulldogs, they've got a different frame. So, but I wasn't thinking of that. She had something happen. We took her to the vet, and they said she had severe arthritis through her spine. That's not why I took her in, but through the x-rays, I couldn't find anything. And they said, the vet says, wow, she's got, and it told me why she wasn't jumping up on a bed or jumping up on the couch. She was jumping up very straight backed. And of course, it was because of the severe arthritis through her spine. Well, I heard, and then I just started in LifeWave, and I started putting my old patches underneath. I took them off 12 hours, and I put them underneath her collar. And within 6 months, she was jumping up. I think it was even less than that. But when my sister and I, 4 years ago, drove down here, I don't know if it was something through the drive. We got down here, the night I got down here, that patch. This is a side view of her little vulva. I know it's not a pretty picture, but that was coming out where she goes pee pee. Those tumors, it was like 3 of them. And I went, oh my gosh, what is going on? So I patched her middle picture. One is an Eon and one is an X39. And I didn't have a vet yet or anything. And so the picture, the last one on the right side, that's what I woke up to. So within 24 hours, we went from the left side, 3 bulging tumors coming out, to that shrunk up little, and that ended up being a mast cell to MAST, a mast cell tumor. I had other dogs die of mast cell tumors. They have legs underneath the skin. Even though you take the tumor off, it's very hard for them to get the like little tentacles. It grows under the skin. And my dog is in remission now 4 years. I had 2 other dogs die of mast cell tumors after the operation. So there's no getting it all, but I know this is a testimony for the patches, that she doesn't have cancer today because of the patches. No arthritis, no patches. How did I do?
Fantastic. Thank you, love. She's living her best life with you. You can see, and she's just loving you too.
Love my girl. Yeah, love my girl.
Such a sweet pup. Well, I'm telling you something super fresh. This, and I will try to go fast as well. Panda was at death's door last week. So I'm just showing you a few pictures from the last 24 hours. She's doing amazing. So this is how I found Panda last week. You can see her drooling and holding her mouth funny, no energy, not well at all. And then my son took her to the emergency vet, and they opened her mouth. Her mouth smelled like death, and you could see that her tongue is necrotic. That means her tongue flesh is dying. And we don't know how this happened, but what they were recommending was $992 to keep her overnight, hydrate her, and run some tests. I did not have $992. So they said, well, the other option is euthanasia. And I'm like, well, I have these patches. Let's bring her home and we're going to see what we can do. And so, first thing we had to do is hydrate her and give her, get her some sort of calories. And so, of course, I had a dear group of friends praying for her. You can see how my daughter and I first started putting patches on her on the top left here. We cut an arm off, a sleeve off of a, a t-shirt that we felt okay sacrificing, and we cut holes in it for her arms and slid the t-shirt on her because her previous experiences with trying to patch her before, she's very active, very sensitive, and she would if I tried to put the patch on her in any shape, form, or fashion, she would run through the house, rub it off, kick it off, lick it off, do something to get rid of that patch. She was in no mood to get rid of that patch, but I also wanted the security and the softness of the sleeve to keep that on her body so it could do its job. And as you can see, it progressed. I was able to get some X2O. That's our LifeWave light infused water. Tracy, our friend Tracy, has a machine about 20 miles away. So I was able to get a few bottles of that water and feed Panda by syringe. And of course, if she was in any pain, I had 3 sets of LifeWave on her. What a beautiful thing to be able to patch your pet who you don't know. I mean, obviously she was suffering, but I don't know how much pain she was in, but at least I could cover my bases and put a few sets of LifeWave on her and it help her be more comfortable. So you can see my patched up girl. We had a remote frequency. I have a friend who also uses the patches, but she has a scanner that can scan remotely. And things were coming up with sciatic pain, possibly for Panda. And that got me down to thinking, okay, let's get her into a chiropractor who adjusts animals. And so I did that, and I'm so thankful for that. He said, yep, her back end is really messed up. So that gave me the idea that maybe my healthy, active 6-year-old cat, who is a little bit crazy and athletic, um, might have jumped off of something and misjudged her jump. Often at night, she'll jump onto the top of the refrigerator and then she tries to jump onto the island. Well, if she missed, she might have bumped her chin and bit her tongue. And these are all just theories of what happened. We don't know exactly what happened. She might have bit a cord and burnt her tongue. We don't know. But the fact is, I knew I needed to get hydration and some calories into my baby girl. So the X2O water, and then I did 2 different collars. You can see the pink collar in the middle picture there. She's wearing her green collar, which I think it had green has carnosine and glutathione on it. And then the pink collar has Eon and X39. So every 12 hours, I'm switching out the collars. And then you can see her with a patch on her forehead. By this time, she was not well and she didn't care if she had patches on. So I patched her with aloe vera too. I'm like, shoot, if it's soft tissue, we need to bump up your collagen and cartilage production. Let's do that. And of course, ton of prayer. And because she could only receive this food or liquid by syringe, I'm like, how am I going to get some more calories in this baby? So I have been feeding her with kitten formula, and she has been loving it. And she's now onto soft food that she can lick herself. So let me go back 2 slides. Do you see the tongue? Look at the tongue here, necrotic, gross, right? Okay.
Wow.
See this tongue here? We took this picture about an hour before this call tonight.
Wow, Cami.
Is that not amazing?
Oh my
I got my baby girl back. She's eating on her own. Now she still cannot lap up water, but so we're still syringing water for her, but she's eating very soft food on her own and she feels great. So great that she jumped up onto the top of the laundry room closet. She still has her LifeWave patches on, but she's living her best life.
Oh
She's
no.
alive.
Wow.
So that's my baby girl.
Hmm.
So
Yay, X39.
yay for X39, restoring her repair cells, right? Regenerating my baby. So only AccuLife is advertised for animals. AccuLife and LifeWave are the same patches. Again, we're non-invasive. I saved $992 just to test her and find out what was wrong. And that wasn't even treating her. They were talking about possibly doing a stomach tube to feed her and all the things. And I couldn't do it. So I'm so thankful. Remember, your patches work shiny side toward the body and they go 3 inches deep. So it goes through fur, it goes through clothing. So just get creative. Find ways to get those patches on your pets in ways that they're not going to ingest the patches. And be creative because it's worth it. So living well is not only for people, it is for your fur babies too. So there you go. That's my story, and I'm sticking to it.
I just add something. There